Welcome to the Healthcare and the ADA Inclusion of Persons with Disabilities webinar series. I'm Louis Krause from the Pacific ADA Center, your moderator for this series. This series of webinars is brought to you by the Pacific ADA Center on behalf of the ADA National Network. The ADA National Network is made up of 10 regional centers that are federally funded to provide training, technical assistance, and other information as needed on the Americans with Disabilities Act. You can reach your regional ADA center by dialing 1-800-949-4232. As real-time captioning is provided for this webinar. The caption screen can be accessed by choosing the CC icon in the meeting control toolbar. To toggle that meeting control toolbar on, press the Alt key once and then press it again a second time. As always in our sessions, only the speakers will have audio. The audio for today's webinar is being broadcast through your computer. Make sure your speakers are turned on or your headphones are plugged in. You can adjust the sound by navigating to the audio settings on the bottom panel. You can adjust the sound by sliding the soundbar left or right in the audio tab. If you do not have sound capabilities on your computer or prefer to listen by phone, you can dial 1-669-900-9128 or 1-646-558-8656 and use the webinar ID 760-897-977. And do recognize that this is not a toll-free number. And also I wanted to mention that the webinar is being recorded and you can access it on the ADA Presentations website next week in the archive section of the healthcare part. This webinar series is intended to share issues and promising practices in healthcare accessibility for people with disabilities. The series topics cover physical accessibility, effective communication, and reasonable modification of policy issues under the Americans with Disabilities Act of 1990, the ADA. Upcoming sessions are available at adapresentations.org under the Schedule tab, then follow to Healthcare. These monthly webinars occur on the fourth Thursday of the month at 2:30 Eastern, 1:30 Central, 12:30 Mountain, and 11:30 a.m. Pacific time. By being here, you are on the list to receive notices for future webinars in this series. The notices go out 2 weeks before the next webinar and open that webinar to registration. You can follow along on the webinar platform with the slides. If you are not using the webinar platform, you can download a copy of today's PowerPoint presentation at the Healthcare Schedule webpage of adapresentations.org. At the conclusion of today's presentation, there will be an opportunity for everyone to ask questions. You may submit your questions using the chat area within the webinar platform. The speakers and I will address them at the end of the session, so feel free to submit them as they come to your mind during the presentation. To submit your questions, you can go to the chat area text box, or you can press Alt-H and enter your text in that chat area. If you are listening by phone and not logged into the webinar, you can ask your questions by emailing them to adatech@adapacific.org. That's ADATECH@adapacific.org. If you have any experience of any technical difficulties during the webinar, you can send a private chat message to the host by typing in the chat window. Type your comment in the text box and enter. And if you're using keyboard only, you can use Alt-H to access the chat box via those keyboard keys. You can also let us know of any problems by emailing us at adatech@adapacific.org, or you can call us at 510-285-5600. Today's ADA National Network Learning Session is titled, Who Let the Dogs and Miniature Horses In? Service Animals in Healthcare Facilities. According to the Bureau of Global Public Affairs within the U.S. Department of State, approximately 500,000 service dogs assist people with disabilities across the country. Under the Americans with Disabilities Act, or the ADA, service animals must be given access to places their human handlers go, including healthcare facilities. As service animals become more common, healthcare professionals are more likely to come in contact with them in doctors' offices, hospitals, and other medical settings. During this webinar, we will address the definition of a service animal, places a service animal can and cannot visit with his or her handler, the questions that can be asked of the person with a disability, and how to interact with a service animal. We will also review a sample service animal policy for healthcare facilities. As a healthcare provider, this webinar will help you understand the ADA, service animals, and the implementation of procedures that will enhance your ability to provide comprehensive patient-centered care. Today's speaker is Pam Williamson. Pam is the Assistant Director of the Southeast ADA Center, project of the Burton Blatt Institute at Syracuse University. The Southeast ADA Center is a member of the ADA National Network. Ms. Williamson has extensive knowledge of the Americans with Disabilities Act, building the capacity of organizations to facilitate voluntary compliance with the ADA, supported employment, special education services, and aging populations. She has also contributed to the development and implementation of 3 online courses: ADA Basic Building Blocks at adabasics.org, At Your Service, Welcoming Customers with Disabilities at wiawebcourse.org, and the ADA Title II tutorial at adatitle2.org. So Pam, I am now going to turn it over to you.
Thank you, Lewis. I greatly appreciate that introduction, and I look forward to talking with all of you today about service animals. You know, we often get to talk to our Department of Justice colleagues, and they said when they first wrote the regulations for service animals almost 30 years ago now, they thought this is a one and done. We will be finished. Service animals will be easy. 30 years later, we're now looking at it going, you know, there's more to this than we realize. So this is what we're going to talk about today. So you will know, for accessibility purposes and also for my own accommodation, I do have assistance with the slides today. So I will be asking our tech assist person to advance the slides for me by saying next slide, please. So if you will go ahead and advance the slide for me. As Lewis said, we do have some learning objectives for today, and we are going to look at the definition of service animals. We're going to talk about the questions that can be asked about a service animal. We're going to identify the places that a service animal can and cannot visit with his or her handler. And then we're going to talk about how to interact appropriately with the service animal and its handler, and then talk about a couple of sample service animal policies. Next slide, please. Next slide, please. As you know, this is a product of the ADA National Network. I just want to remind you that if you have any questions about service animals after today's session, please do call your regional center at 1-800 949-4232, or visit our website at www.adata.org. Next slide. And a shout out to our funders, without whom we would not be able to do these webinars. We are funded by the Administration on Community Living and NIDLR, the National Institute on Disability, Independent Living, and Rehabilitation Research, and we do thank them for their funding. Next slide, please. Okay, we're going to take a few minutes here and just do a very brief look at the Americans with Disabilities Act. Now, I am sure there are many seasoned folks on the webinar with us today who know this stuff, but this is always a good refresher. And the reason for that is if we go back to the basics and go back to the foundation of the ADA, it really helps us to look at the issue of service animals in context. And if you're talking with a healthcare provider or another organization, it also may be helpful to you to have some talking points about why this is important. And last but not least, it would also help organizations when setting policy to understand the depth and breadth of the ADA. So next slide, please. So what is the ADA? So this year is the 30th anniversary of the ADA. It's a civil rights law, and it was passed in 1990. And it was all about promoting equal opportunity for people with disabilities in the areas of employment, state and local government agencies access, and by private businesses. The goal of the ADA is always full inclusion of people with disabilities in all aspects of American society. I want us to look at that term civil rights briefly, because civil rights, according to the legaldictionary.net, is really a term that refers to the basic rights that are given to an individual by the laws of the government. And this is regardless of race, nationality, color, gender, age, religion, or disability. And we often think of these things in the light of equal citizenship, equal protection under law, due process, and equal access. So when we talk about the ADA, we always need to remember it's in that equal opportunity, equal access framework. In other words, it's a civil right to be able to have access to our communities. So therefore, disability rights are civil rights, and we need to keep that in mind. Next slide, please. So under the ADA, there were 4 goals that Congress stated, and they were that we assure the equality of opportunity, full participation, independent living, and economic self-sufficiency. And as you heard earlier, over 500,000 people in the United States use a service animal in order to assist them with some disability-related issue. So therefore, for many people with disabilities, having a service animal allows them to take full advantage of these 4 goals that we set out in the ADA. And we need to remember that, again, these 4 goals are the foundational areas of our law and what makes it work. Next paragraph, next slide, please. Now today we are going to specifically talk about Title II, which applies to state and local government programs, and Title III, which applies to public accommodations or private businesses, including nonprofit groups. So if you're interested in service animals as related to employment, please visit www.adata.org, and you may access a document there that talks more about service animals as a reasonable accommodation. Next slide, please. So under ADA Title II or state and local government agencies, some examples of healthcare facilities might be hospitals that are operated by a state or local government, public healthcare clinics, county departments of health, or state-operated mental health clinics or mental health hospitals. Next slide, please. And under ADA Title III or public accommodations, some examples of healthcare facilities could be private hospitals, and these could be for-profit or nonprofit or not-for-profit, urgent care clinics, doctor's offices, mental health care providers, and dentist offices. Next slide, please. So as we get ready to talk more about service animals today, we need to look at a term that's in the ADA called reasonable modification. And reasonable modification is used in both ADA Title II and ADA Title III. And the plain language definition is really adjusting or modifying policies, practices, or procedures if needed so that a person with a disability can access goods, services, the building or facilities, privileges, advantages, or accommodations. Next slide, please. And this is where service animals come in, because under the ADA, a service animal is part of this reasonable modification of policy, practice, or procedure. So generally, according to the regulations written by the U.S. Department of Justice, any public entity or private businesses must modify its policies, practices, or procedures to permit the use of a service animal by an individual with a disability. Next slide, please. So what are service animals? Let's go to the next slide. Okay. A service animal is a dog that is individually trained to do work or perform tasks for the benefit of the individual with a disability. And this could be a physical disability, a sensory disability, such as a person who may be deaf or blind, a psychiatric disability, an intellectual disability, or any other type of mental disability. The key words here is individually trained, and the dog also has to be able to perform tasks. Something has to be for the benefit of the individual with a disability. We're going to talk more about this in a little bit, but one of the things I want to remind you of is that trained does not necessarily mean professionally trained. The ADA does not clarify whether or not the dog has to be professionally trained or can be trained by an individual. The key is the dog must be trained and must have do certain tasks. Next slide, please. Oh, the title on this slide is Monkeys and Ferrets and Snakes, Oh My. For those of us that have been around for quite a while and working in the field of the ADA and disability-related issues, we remember the days when there were service animals or animals that were being stated to be service animals, such as a service snake or a service pig or a service parrot. And unfortunately, that really muddied the waters. So the ADA regulations in 2010 were modified to basically state that dogs were the only service animal. So any species other than dogs, whether they're wild or domestic, trained or untrained, are not considered service animals under this part of the ADA. And so unless a healthcare facility allows these types of animals in as pets, then they are not covered under the ADA. However, we do have a caveat for miniature horses. Next slide, please. When in 2010, when the ADA regulations were rewritten, miniature horses were added as another type of service animal that could be provided via reasonable policy modification. So, and a miniature horse, so a reasonable modification to policy would allow a person with a disability to use a miniature horse that, again, has been trained to perform certain tasks related to the disability. This particular addition to the regulations was a compromise because there are some communities that do not believe that dogs can be used, or that they are unclean, and that a miniature horse was an option that could be used as a service animal. So therefore this was included as part of the regulations. Next slide, please. Now, as we talked about before, and I want to reemphasize again, service animals are working, they're active. So they're not there to be petted. They're not there to play with anyone else. They are there to serve the person with the disability, and that is their person. So they must have specific actions, tasks, or work that they perform. Now, having said that, there are some animals simply just by being present, they may provide comfort, companionship, emotional support, or other benefits, but they're really not trained to do anything, and they're not considered to be service animals under the ADA. I'll give you an example from my own life. I have severe migraines. My dog is a comfort to me, especially when I have migraines. He has learned when I have migraines that my face draws up on one side, and he comes and licks it for me. He wasn't trained to do that. He doesn't alert me that the migraines are coming. He just knows Mama doesn't feel good. Okay, he is not a service animal. Next slide, please. Now, some examples of a service animal's work, and this is not an exhaustive list by any stretch of the imagination. It might be providing physical support and help with the balance and stability for people with mobility disabilities. So, guiding an individual who is blind or who has low vision, pulling a person's wheelchair. So, it could be retrieving or picking up items for a person with a disability. Next slide, please. Alerting an individual who is deaf or hard of hearing to sounds, possibly preventing or interrupting impulsive or destructive behaviors for people with psychiatric or neurological disabilities. And many people veterans who have PTSD often have a service animal that will press up against them and alert them that they're escalating and need to get to a calmer area. So before some type of episode occurs. And then also too, so a service animal can alert individuals to oncoming seizures. These are just a few examples of the many services that a dog might be able to provide. Next slide, please. It is very important to remember that a service animal is not a pet. And this is one of the issues that often comes up when there are children who may have a service animal. And in this case, we have a picture of a young boy who has autism, and he has an autism service dog, and he's at the doctor's office and visiting, and you see we have mom in the picture and the little boy, and then the service dog and the doctor, and the mom and the little boy and the service dog are on the floor. The dog provides a calming presence for this little boy, and therefore would be and has been trained to intervene on this little boy's behalf. So therefore, this would be considered a service dog. Next slide, please. So let's do a little comparison here. So we have Marge, and Marge has a psychiatric disability, and her dog Harry can tell when her anxiety level is rising, and he's been trained to respond by moving himself in front of Marge and nudging her away from her current location. So Harry would be considered to be a service dog because he's trained, and he knows when her anxiety level is rising, and so his task is to nudge her away from the current location. But then we have Aaron, who also has a psychiatric disability. Now his dog Will is very good natured, and sometimes he can tell that Aaron's becoming anxious, but he's really not trying to do anything to help Aaron. He just plops down and sits there and provides company. So this is the thing. This is where you have to look at things very carefully. And the key again is that the dog has been trained to respond and to provide some type of service to the individual with a disability. So next slide, please. So sometimes we get asked, what's the difference between a service dog or a miniature horse? Now, service dogs are typically allowed in nearly all areas of the public, all areas where members of the public are allowed to go. Now, as I stated earlier, Department of Justice regulations actually has a separate provision about miniature horses. So they're actually subject to a few additional considerations. Next slide, please. When a miniature horse is brought in as a service animal, so typically a miniature horse is going to range in height from 24 to 34 inches and weigh between 70 and 100 pounds. So even though an entity may be willing to modify their policies and procedures to allow a miniature horse, there has to be some things that are looked at. And part of that is the type of miniature horse, the size and the weight, because a facility may or may not be able to accommodate the size of the miniature horse. So now there's also the need to look at the legitimate safety requirements. Will the miniature horse's presence compromise any safety requirements? All of these things have to be evaluated on a case-by-case basis. Next slide, please. Again, emotional support animals are not covered by the ADA. The mere presence of an animal is not considered to be a service, even though they may provide support to the person with multiple disabilities just by being there. They are not trained to do any specific task or any specific work. Next slide, please. Now, I want to discuss therapy animals briefly, because therapy animals are used in many healthcare settings. Many years ago, when I first started out in my career, I was a recreational therapist, and we had therapy animals who came in to see the patients in the nursing home where I worked. So everybody loved the therapy animals, especially a couple of my folks who were not able to get out of bed on a regular basis, loved to have the dogs come in and snuggle with them in their beds. It was great, but they are not covered by the ADA. So if they are given obedience training, they are going to be well trained, and they may provide a benefit, but it's not to the handler. It's not to the person bringing in the dog. It's to the people that they are visiting. So they're granted access to places by agreement. You have an agreement with a nursing home or a children's hospital or a senior center or maybe even a school. There are many places that might allow therapy animals, but again, it's by agreement. Now, some states do allow therapy animals out in public, so you do need to check your state's laws to see if there's anything specific related to therapy animals. Next slide, please. So now let's get down into some of the details about service animals in a healthcare facility. So next slide, please. So service animals in a healthcare facility, are they allowed? And the short answer is yes, they are allowed, unless it creates a direct threat to other persons or there's a fundamental alteration in the nature of services. The CDC has issued guidelines in addition to the the regulations that are in the ADA. Basically, Service animals are allowed in hospital rooms and anywhere the public is allowed in a healthcare facility. Some of the places a service animal might not be allowed would be the ICU, a sterile area in a burn unit, or an operating room. So, because these are places that either there would be a fundamental alteration due to the sterile environment, or because the general public would not be allowed into the operating room. So now, having said that, let's talk about this a little more. Next slide, please. There are times when a person may enter a hospital or come into the care of some type of facility, and that person may not be able to care for the animal. And sometimes difficult decisions have to be made about, whether or not the animal can stay. So let's look at those three things. Next slide, please. First of all, as always, evaluate everything on a case-by-case basis. So is the patient able to take care of the animal? What is the healthcare situation of the patient? Is the patient so sick that having the animal may be disruptive to their care? Is the animal going to be able to handle the 24-hour environment of the healthcare facility? Also, too, determining whether or not significant risk of harm exists. Is this a sterile environment? Is it an isolation unit? Are there things that may happen that would be harmful even to the dog? Or to the patient because of this. And then the other thing always is to determine whether or not there are reasonable modifications in the policies or procedures that will mitigate the risk. Are there, can it be worked out so that a family member can come in and take care of the dog? Are there things that the staff can do? It's not always a very clear picture, and sometimes these things have to be looked at very carefully. Next slide, please. Now, if a patient must be separated from his or her service animal while in the healthcare facility, you must work with the person to find out what arrangements have been made for supervision or care of the animal, because you can't just put the animal out on the street. So work with the person to determine what the needs are of the animal. If a family member or friend cannot come in, it's always good, best practice, to have a conversation between the medical care team to figure out and help the patient figure out next steps. So also, too, you'll need to make sure that there are arrangements in place to address the patient's needs in the absence of the service animal. How are the patient's needs that are typically addressed by the service animal going to be addressed by the medical care staff? Next slide. Next slide, please. Now, it is not, let me back up. In the media today, we often see articles about various service animals, and occasionally we see negative press about service animals. And that really is disappointing, because service animals provide such a benefit to people with disabilities. So it's always good to know the questions that can be asked. And these questions can be asked when the information is not obvious. The first question is this animal needed because of a disability? Now, the person does not have to give you their whole medical history, all the information about their disability. So they can say, I need this animal to help me with my disability. And we must take that at face value, and we must have trust that the answer is accurate and correct. And then the other question is, what work or task has the animal been trained to do? So, sometimes, so when a person has a psychiatric disability, you can't necessarily see that. So the person might say, the dog helps keep me calm in stressful situations. So so those are the kinds of things that they can talk about. Another thing might be that, for a person who is deaf or hard of hearing, the dog alerts me to sound so that I can be sure that I'm getting the notices that I need in order to be able to respond. Yeah, those are the kinds of things that you can ask, and possibly some answers that you can expect. Next slide, please. Now, if it's apparent, if you can see that a person has a disability, for example, you've got a person who's using a wheelchair and they have a dog and the dog is pulling them along, that is very obvious as to what's going on. The dog is assisting the person in pulling their wheelchair. The dog may have other tasks that it performs, but at that point in time, the primary task is pulling the person in a wheelchair. So we don't need to go into a deep dive on these questions. So if something's there and you can see it, go with it. Next slide, please. Now, there are some things you cannot ask, and you cannot ask for any documents, certificates, proof, or any details about the individual's disability or the animal's training. So, we talked about earlier some of the responses you might get. So, if a person says, I have a disability and my dog retrieves things for me, that's enough. And so a person doesn't have to say, I've got so I have I'm a double amputee below the knee and I wear prosthetics and the dog provides support for me. Okay, they don't have to get that detailed. So next slide, please. Now, there are some things you can expect from a person with a disability in the service animal. Next slide, please. The service dog or miniature horse must be housebroken. Now on this slide, you have a picture of a beagle looking at a sign that says toilet with an arrow pointing right. So I must admit, I got this picture because I have two beagle nephews and love them dearly, and one of them would probably read that sign to you. So, but the bottom line here is that the service dog or miniature horse must always be housebroken. So, and that means being able to take the dog out or take the horse out. Some of the horses may have the small bags underneath. So there are different ways that you can know that the dog is housebroken or miniature horse. Next slide, please. The regulations also state that a service animal must have a harness, a leash, or tether unless the individual, because of the disability, is unable to use a leash or the leash would interfere with the animal's work. So there are some people who don't have the manual dexterity in order to be able to hold on to a leash, or if they were to hold on to wrap the leash around their wrist or arm, there's a risk of falling. So, but also too, so there are sometimes for dogs that are seizure alert dogs, a leash may interfere with their ability to be able to get to, if the cue is to get up to a person and put their paws on their shoulder or their face to their face, then they may interfere. But regardless of that, even if a service animal does not have a leash on and is not tethered, it must still be under control by voice command or hand signals. The bottom line is a service animal must always be under control of the handler. Next slide, please. A lot of the questions we get from various places is, well, shouldn't that service animal have a vest on? The answer is no, because it is not required under the ADA. Now, many service animals do wear harnesses or vests or something that identifies them as working animals, but it's not required. And also, too, just because a person has printed off or paid for some type of certificate or documentation from an online service does not mean it's legitimate. So you can't ask for or require certificates, documents, or proof of the service animal status or training. Some people may have this, but again, not required. Next slide, please. Now, there are times when a service animal may need to be excluded, and a service dog or a miniature horse can be excluded if it's not housebroken or it's not under control of the handler. So I've personally had an example of when I was at a conference one time and someone had presented their animal as a service dog, and the service dog started attacking other service dogs and got loose and started running through the conference area. Even though I love dogs, that was a very scary time. And so anytime an animal's running around, jumping on people, growling, snapping, and cannot be controlled, so it is the right of the public entity or the public accommodation to ask for the animal to be removed from the situation. But here's the key: you're removing the animal, not the person. So that's the thing to remember: it's the animal that must be removed, not the person. Next slide, please. And so the fear of employees or other people's fear of animals or allergies are not valid reasons to exclude service animals. Now, the example I'm getting ready to share with you actually was an employment situation. We had I worked in a disability organization, and we had a person who had a service animal, and then we had another person who was terrified of dogs of any kind. And although the service animal was well trained, was one of the most docile dogs I'd ever met, the person who was afraid of animals literally could not be in the same room without just freezing up. And so what we did in that situation is that we were able, because of our office setup, to accommodate both parties by putting one on one side of the large office area and one in a separate area of offices. And then the only time that they may have to interact was in a staff meeting, and at that point in time, the person with the service animal made the decision on her own that she would leave her service animal in her office behind a gate while she was in a staff meeting, because it was such an issue. So you have to get creative sometimes, and you have to think beyond just this area you may be in. What kinds of things can be done? Because a person with an allergy or a person with a fear is not necessarily going to rise to the level of disability under the ADA. Next slide, please. We talked about earlier and a couple of slides ago that you're excluding the animal, not the person. So just remember that the person must always have the opportunity to continue to access the goods or services and participate in the activity even without their service animal. Next slide. We talked about care and supervision, and I want to address this even more here, because even in a hospital or healthcare situation, the individual with a disability is still responsible for the care and supervision of their service animal. The staff at a healthcare facility do not have to feed, water, or walk the service animals. Healthcare workers in the healthcare setting are never, ever required to do this under the ADA. Having said that, though, if you're in a situation where the facility accepts pets and it's part of the normal service that might be provided, maybe in an Alzheimer's care center or something of that nature, then of course, you would want to accommodate the service animal as well as the other dogs in the facility. But so typically, healthcare staff are not required to provide the care or supervision. Now, I want to address this further because in recent weeks, there has been an article floating around on the news and in social media about a nurse who chose to take care of a veteran service dog. The veteran was a gentleman who was blind. He went into the hospital. It happened to be for COVID-19. And, he thought he was going to be in and out, go to the emergency room, be in and out. And he was there for 19 days. And a nurse chose to take care of his service animal and to set up something at the hospital so that the service animal could stay with him. This hospital and this nurse chose to go above and beyond the ADA. Remember, the ADA is always a baseline. But it's not required, and you should not expect it of a hospital or other healthcare facility. Next slide, please. Now, although it's not required, a healthcare facility may choose to provide a relief area where the individuals can take their service animals. They've got to take care of their business somewhere. So this is always something good to look at. And even though it's not required, it is good customer service. Next slide, please. Now, we always want to remind folks that, in addition to the ADA, there may be some state or local laws that apply. And if a state or local law has something in it that makes it better for people with disabilities, it's going to override the ADA. But if the ADA is better for the person with a disability, then it's always going to override the state or local law. Laws vary from state to state, especially where service animals are concerned. So I encourage you to check your own state's laws to find out if there are certain things allowed in your state that may not be allowed somewhere else, because you always want to make sure that you're in line with both federal, state, and local laws. Next slide, please. I want to talk about surcharges because obviously, all of us like to make sure that we are watching our dollars, and we want to make sure that we understand that extra fees cannot be imposed on individuals who are using service animals, because service animals are not pets. And again, so make sure it's always a good idea if you use a healthcare facility for something, check your bill carefully. Most healthcare facilities aren't going to add an extra charge. This is usually we usually see this happening in places like hotels, but you ought to always be sure, because a service animal is there to provide some kind of service or do some task for the individual with a disability. So we want to make sure that that everyone understands and remembers this. The other thing too is, though, if a person's service animal does cause any type of damages, then if you normally charge any guest or customers coming in for damages to a place, then you can also pass on that cost to the individual with a disability if their service animal has any, causes any damage. Next slide, please. We're now going to talk about service animal policies and procedures. So if you can take me to the next slide. The ADA regulations do not require a service animal policy. However, it is best practice and highly recommended. So many years ago, I had somebody tell me that if it's not in writing, it really doesn't matter, because if you don't have a policy in writing, it makes it difficult to follow, and it makes it even more difficult to enforce. It also having a policy in writing limits the guesswork, because everyone can have access to the same information and know how it needs to be applied. Next slide, please. Now, the Michigan Department of Health and Human Services has a fantastic service animal policy, and also some forms. Now, these are all available to you in the PowerPoint, so if you have not yet downloaded the information, I encourage you to do so, because this information actually has been shared across the state of Michigan with their various state entities, and they have the policy for hospitals and facilities. On this arrival checklist, they have different questions about what service, the basic questions of what services the animal provide. Do you have someone, will you be able to care for the animal while they're here? All those kinds of things that need to be in place. And then, if for some reason the animal does need to be excluded from the facility, either because the patient's in ICU or some other reason, then they have a very good step-by-step process for doing this. I recommend taking a look at these policies as examples, because they're very well done, and they are very much in line with the ADA. Next slide, please. Okay. The U.S. Department of Justice also has a sample policy in one of its settlement agreements, and this was with a doctor's office where a service animal was being denied entrance into the doctor's office. So this is a good policy to follow. It is more basic than some of the other ones that other hospitals have put together, but because it comes from the U.S. Department of Justice, you will know that it has at least been through that enforcement agency's oversight, and will be a good thing for you to look at. When you go to this settlement agreement, you will need to go to attachment A, because that's where the actual service animal policy is located. Next slide, please. Another healthcare system, and for my colleagues in California, kudos to your group at Stanford Healthcare. They've got an excellent service animal policy. We have a link to the policy summary with service animals in the Stanford Healthcare facilities, and then a link to the full policy. And their policy actually covers service animals and comfort and emotional support dogs. So they actually have decided to go above and beyond the ADA and look at those issues. So that, because they understand the importance that a pet may have in a person's life, and want to provide that option. Next slide, please. Another service animal policy is from Johns Hopkins in Maryland. And they have this actually, and you're planning the visit, so it's very helpful both for a patient who may have a service dog, but also a visitor who may have a service dog. They address both issues, and I highly recommend looking at their policy. All of these policies, again, are just examples. I can't you put a check mark on one over the other, but I do recommend looking at policies that have already been put in place in order to address the issues related to service animals. I will give you another example of a way not to do things. From a personal experience, I actually was hospitalized myself back in January, and was in an isolated room, and I was talking with the nurse in charge, and when he found out what I did, he says, well, what do you know about service animals? Well, you can imagine the conversation that ensued. But I looked at him, I said, does the hospital have a service animal policy? He says, we do not. This is one of the largest healthcare organizations in the state of Georgia, and yet it does not have a service animal policy. And I did my own research after leaving the hospital and have found that out. So, you know, and he told me that because they did not have a service animal policy, that they had had some issues with people, you know, bringing in different kinds of animals, and they had to allow them because they didn't have anything that said they couldn't. So again, that policy and those procedures and putting those into place are very, very important. And I want to encourage you to take a look at these. Next slide, please. Hey, following, I have several resources for you. I am not going to go over these in depth because I do want to take time to answer your questions, but I will have Gabe move me to the next slide just so you can get an example. Actually, Gabe, if you'll go 2 more slides, that would be great. 1 more. There we go. Okay, I have put these together for you, specific to healthcare facilities, and they are divided up by the organization or the federal government agency that put them together. There are about 5 or 6 slides, maybe a few more with resources. I encourage you to take these, look at them. They are comprehensive, and they'll give you a lot of good information. And you can get us past the resources, and then I think we're about to Q&A. One more, or are we at the end? Lewis, I think we're at Q&A.
All right, thank you so much, Pam. That was a great presentation. All right, everyone, remember this is your chance to submit your questions in the chat window, and we'll go through them right now. So here's your first question, Pam. Someone asked, for a policy, is there something we can reference regarding the number of service animals a person can have? We have a customer that brings 6 service dogs.
Wow, this is called Stump the Trainer. So actually, the U.S. Department of Justice has addressed this, and because I looked at this question earlier, but so the U.S. Department of Justice in its 2010 document, Frequently Asked Questions About Service Animals in the ADA, states that a person might be able to have more than 1 service animal. And so, but here's, hold on just a minute, let me pull that up so I can tell. But basically, what the U.S. Department of Justice says, that it is possible that a person might have more than 1 service animal, and to do different tasks. And an example that they give is that a person who has a visual disability and a seizure disorder may use 1 service animal to assist with wayfinding and being able to navigate the area, and another service animal that's trained to perform as a seizure alert dog. Now, they do not actually go above the number 2 on the number of service animals. And I have not seen that addressed as more than 2 service animals in other places. Lewis, do you remember any guidance on that? Because 2 is usually the limit I've seen, but that's just because that's what's been put out by the U.S. Department of Justice.
I haven't seen anything one way or another about that one, but I would say this: take the tenets that Pam just described to you, and if you apply the 2 questions to each of the animals, that might help you in the conversation with this individual, because it is a case-by-case basis, right? There might be multiple items that each animal might deal with each of the items. But if not, then that would actually clarify it. For example, we've had an instance of someone who had a couple of service animals and when asked, they said that the first service animal did a particular task and the second service animal interpreted for the first service animal. That obviously would not be a definition of a service animal. The service animal has to do the task for the person, not for the other service animal.
Right.
So,
And I am getting ready to put a link to the frequently asked questions about service animals in the ADA in the chat area. And if you'll reference question 13, that'll give you information straight from the Department of Justice.
okay.
Next
And
question.
while you're doing that, let me read you the next one, which says, pardon me. What are the ADA guidelines in regards to a service animal going into the shower with the handler? We operate a recreation facility and we have had multiple complaints about a user who brings their, quote, service dog in the shower with them. The shower is communal and not individual stalls.
Again, the ADA states that the service animal is allowed to go basically anywhere the public goes, unless it's going to be a fundamental alteration to the service or a direct threat. So if you've got concerns, then there is, you would need to look at it and make a decision on whether or not it is fundamentally altering the experience, and are there reasonable modifications in place that would allow this person to still be able to take a shower, and because the dog may be allowing the dog may be supporting that person in the shower in some way and providing assistance. So the other question is if it's a direct threat, you would need to look at that issue and assess it on, again, a case-by-case basis. That is a pretty high threshold. And it's typically, direct threat is typically defined as significant risk or of substantial harm. And there is a 4-part process that you have to go through in order to look at that and do the analysis. Now, if you've got more questions about direct threat, I would encourage you to contact the ADA Center and talk to an information specialist who can really get into more of the details with you as to what that might look like.
Okay, next question. What should we do when patient has no one to walk or feed the service animal during an inpatient stay? Staff and volunteers are often concerned about their liability if something happens to the dog during a walk. Now, I think Pam covered that, but I don't know if you wanted to say something else regarding that, Pam.
Yeah, I would just like to reiterate the point that the ADA does say that that the service dog must be in control, must be under the control of the handler at all times. So if the person is not able to control the dog, and that's when it is best practice to bring in the various people that can help address the issue. Is there a social worker at the hospital that can help find alternate placement while the person is in the hospital? If there's not a family or friend nearby, sometimes you do have to get creative sometimes. And as we all know, there are situations when a person's in the hospital and they may or may not be able to make the decisions. And sometimes you've got to make sure that you document everything. But the service dog, the hospital, and if they choose to go above and beyond, that's fine, but it's not required. And therefore that's when a plan needs to be put in place in consultation with the patient.
Next questions, and this is, I don't know what this is, an interesting sign here from the universe. 2 straight questions from different people about a similar topic, which is, what if service dogs come to the facility in a stroller? Can we have somebody come in with service animals in a stroller?
This is a very interesting question because the U.S. Department of Justice actually really addressed this in a little broader way. But basically, what the U.S. Department of Justice has said is that a service dog must have all four paws on the floor unless the service that they are providing cannot be provided from the floor. So, for example, let's say that a person who has seizures actually has a small dog, and so I'll use a Chihuahua as an example because that's the smallest one I can think of right now. That has actually been trained to alert them to the seizures, and part of the training has been so that the dog actually may ride up on their shoulder or be close to their face so that they can lick their face. That's something I've seen before. It really is going to that's where those questions come in, and what that, and we looked at those. And Gabe, if you can get me back to that page, I can tell you. So if you can get me back to those two questions, I would appreciate it. But yeah, if that's really when those questions come in, because you want to know what the dog service is the dog providing. And because I'm not going to say that dog cannot provide a service from a stroller, but I do think that the question is very legitimate at that point. So there you go. Thank you. So, is this animal needed because of the disability, and what work or task has the dog been trained to do? But typically, Department of Justice has said that four paws on the floor at all times.
All right, next question. And you'll note why I'm asking this one, Pam. What would you recommend if there was an individual with 3 dogs, 2 certified dogs, and 1 emotional support animal, but the landlord is flat out refusing to acknowledge this because they're saying their building is above a meat market and therefore no animals are allowed?
Well, okay, this is a situation where I'm thinking of where I'm hoping that in the question if the person can put in the chat area, if the landlord is this like an apartment or a rental, or is this a business? Because the answer varies depending on what kind of situation it is. If it is someone that has two service dogs and then an emotional support animal, and it's a rental housing type situation, that's going to be covered under the Fair Housing Act. And so those rules are different. And I will be honest, that is not as much my area of expertise. So I would definitely suggest calling the 1-800-949-4232 so that you can talk to an information specialist. If it is an office situation, so again, that's going to go back to employment and potential reasonable accommodation, and could potentially come down to the contract between the employer and the office management, and allowing a reasonable and working out the reasonable accommodation with the employee.
And I would also encourage you, if your questions here do not involve service animals or service animals in the hospital or healthcare settings, that's what we're really focusing on here, definitely call your regional ADA center, because everyone across the country, we're all equipped to answer these questions. This will not be your only chance to get a question answered here. The questions are answered for free, they're confidential, and it's straightforward to do. So we'll put that phone number up in the chat area again for you to get, at 1-800-949-4232. Okay, next question for you, Pam. Can a service animal be restricted from accompanying and remaining with an admitted patient in the hospital during this pandemic?
I'm sorry, Lewis, can you reread the question? My
Sure,
part of my audio dropped out.
sure. Can a service animal be restricted from accompanying and remaining with an admitted patient in the hospital during this pandemic?
Okay, again, so what you have to look at the situation as a whole, and if the service animal is there with a patient with a disability, and uh, the patient needs the service animal while in the hospital and can keep it under control, then the service animal should be able to accompany the person into the hospital. But if there is, if the, of course, we have the unless it's a fundamental alteration or a direct threat, and the direct threat assessment again is a very detailed assessment on whether whether or not there is that substantial risk or harm that may be to others, and so that would need to be an assessment that would be made on a case-by-case basis depending on the situation, and also to the when it comes back to the handler, is the person able to provide the care to the service animal that is needed, or is it or is or do other arrangements need to be made?
The next question has to do with allergies and what about allergies? If they have an allergy to dairy, for example, which isn't a disability necessarily, but the animal is trained to identify it, is this covered?
Okay, remember the ADA is about equal opportunity for people with disabilities. In order to be covered by the ADA, a person must meet the definition of disability. So that allergy to dairy needs to be assessed and looked at and to see if a person is going to meet the definition of disability under the ADA. And so that, again, that's a case-by-case basis and needs to be looked at in that individual case. I mean, there are instances of when a person does have an allergy, and this has come up with peanut allergies, where it may rise to the level of definition of disability under the ADA because the person, goes into anaphylactic shock and it could possibly kill them and it affects their respiratory system. So, and that's being able to breathe and is a major life activity. And so, I'm not going to say that allergies are never covered, but again, just like anything else, it has to be looked at, as to whether or not it's such a substantially limiting one or more major life activity.
Next question. I thought the airlines were trying to limit to two, I'm assuming service animals, but wanted to have something to reference.
Okay, the airlines are actually covered under the Air Carrier Access Act, and we do have information specialists that can answer the question, or you can call the U.S. Department of the Federal Aviation Administration, and for that information. So, but yeah, that's covered under the Air Carrier Access Act, not the ADA.
Right. And another question, as a hard of hearing person, I would like to get a service dog. However, I have a 13-year-old daughter who loves dogs. When at home, how do families work out the relationship with the service animal being at home? At work, is the animal a pet once at home and their vest is off?
If I understand your question correctly, it's basically, once the dog is at home and you choose to take the vest off, they're not working. And, service animals, I mean, service animals either need to be trained by the individual or an organization. And it depends on how they're trained and, what as to whether or not, they're working. Many service animals are trained that when they have their harness on, they're working. When their harness is off, they're not working at that time, and that then you can play with them. But again, that's based on training. Different people and different organizations do it different ways. And so that's something that if you're interested in learning more about, I would encourage you to contact a service dog organization in your area that can provide guidance.
Next question. What if someone with a disability continues to bring a disruptive service animal, by that they mean running around, growling at staff and other patients, etc., to the hospital? What can the hospital do legally to prevent this from continually happening? The patient has ignored all requests to keep the service animal at home.
Okay. I'm going to answer this from the perspective of the ADA. As we discussed earlier, if a service animal is growling, snapping, biting, disruptive in any way, in that way, then you can always ask that the service animal be removed, even at that time. So you can ask that the service animal be removed and allow the person to stay and to take advantage of the services that are being provided. So this is where your policies and procedures are very useful. And if you don't have policies and procedures as best practice, I encourage you to get some in writing. And as to legally, if there are other things you can do, that's best taken up with your general counsel, because the ADA does say you can exclude the animal. But there may be procedures at a state or local level that need to be looked at in order to take those steps in order to make it happen.
Right, and I would just add one little caveat that we like to say around here, which is that the person has the rights, the dog does not have.
Thank you, Louis. Yes.
So, next question. Are service animals in training also considered service animals and allowed in places of public accommodation and employment settings?
That is an excellent question. Actually, that varies state by state. Service animals in training are allowed in some states to be in public and not in others. So that's something that needs to be reviewed at your state level. And in some cases, it may even need to go down to the local level. If your state doesn't have a law, does your local level have a law? But those issues are covered at the state level, and it will vary state to state. And this is where calling your regional ADA center would be very helpful, because they will know about potentially know about the state and local laws that apply in this case, versus the ADA as a whole, which does not address service animals in training.
All right, next question. Are there any changes or modifications being made for COVID-19 and the use of service animals in hospital settings?
No, the CDC has actually put out some guidelines regarding this, and basically at this point in time, they're asking hospitals to follow the guidelines that have already been issued, and I did have put a reference to those in the resources section, because there have been guidelines that have been put together by the public health area of the U.S. Department of Health and Human Services about service animals in situations like this. And so it's really just looking at infection control and things of that nature. Basically, though, if it's for right now, as far as I can tell, and all of the research I have done, so as of today, May 28th, service animals are still allowed in hospitals, unless, of course, there is the fundamental alteration to services or a direct threat issue.
All right, we have a listener who actually has more information about the strollers, and says DOJ's answer to question 31 is about shopping carts and does not say 4 on the floor. For that context, it says generally the dog must stay on the floor or the person must carry the dog. So that was the case found about strollers.
Yeah. And thank you for finding the actual text. And in another place, and I would have to find it, there is guidance that basically says 4 on the floor. So thank you for finding that particular text, because that was one of the first ones I was looking for earlier.
Next question, can service dogs be transferable? Someone with a service dog passed away and gave the dog to an employee, and now the employee is claiming the service dog is for them so that she can bring it to work.
That is a question I am not qualified to answer. So, Lewis, if you've got information, or if not, then, or so.
I would say you should call the local, your regional ADA center and give them the chance to sort of research this question. It may not be something that's very common and known, but probably there is an answer that needs to be researched, and we won't be able to really do it here on this session. So, all right. I'm going through the messages here with. Okay, so there's a couple questions here, and I'm not sure what they mean, but COVID-19 dogs, how many actively working in the USA are demographics? Are you trying to find out how many? Can you clarify what that question is after? Unless, Pam, you have a sense of what that.
I'm not sure I have a total sense, but I think I have a guess. So I'm going to make my best guess here, Deborah. And if, excuse me, yes, Deborah, if you can fill in any gaps in the chat, I would appreciate it. I have read that there are some dogs being trained to detect COVID-19. However, I have not seen any numbers, nor have I seen any specific information about the organizations who are doing this kind of thing. It really is it's just something that made it to the news that it's happening, but like a lot of other things related to COVID-19, it's new, it's up and coming, and it's changing. So unless you've got a more specific question, I'm not going to be able to answer it much better than that.
Right, and then she has a second question also that may need some clarification. I have witnessed so many violations with individuals with service animals who really will help with making these people genuinely enforce and take responsibility for their inconsiderate illegal actions.
As with anything, we see things happen that we know that we at least think or believe that they are illegal, or you think, or the person is trying to pass off a dog as a service animal when we know they are not. Unfortunately, at this point in time, there's not much that can be done. There are some states that have chosen to try and pass fake service animal laws. It remains to be seen as to how effective that is going to be, because it's going to be more difficult to enforce, and so it's it's really one of those things that, again, I encourage people with disabilities who have service animals to, always be prepared to answer the 2 questions. And I personally have friends with service animals that have chosen to print out one of the documents, either from the ADA National Network or Department of Justice, with an explanation of what a service animal is and what they and where they're allowed to go, and take it with them just as an educational piece. That again, that's just something that they've chosen to do. And again, it really comes down to the policies and procedures of a business or state or local government entity, and being able to have those in writing so that they can be referenced, and so that things can be done when they need to address the issue.
Okay, so we're getting a few clarifications here. So she's clarifying, saying, I'm talking about business and government facilities that are doing illegal acceptance of true service animals.
I'm not sure I understand, so I apologize if you, if you.
Yeah, I'm not sure I understand it either, Deborah. Anyway, but while you're writing to clarify that for us, there's a couple of items that have come in here for clarification. One from says that is a link to a BBC news item about a trial that is beginning to see if dogs can sniff out coronavirus. Now, recognize that now that you've been through this session, you can recognize, is that a service animal or not? And would you be walking around with a service animal that's I'm not sure if that's a service animal or if that's something that people are using in a facility to determine whether somebody coming into the facility has coronavirus. So it's unclear to me.
Lewis, this is Pam. I would, a dog that would be trained to sniff out coronavirus or COVID-19, I see in the same light as a dog that would be used to sniff out cancer or something else. Mm-hmm. They do they're not a service animal for a person with a disability as much as they are providing a service for the community.
Right.
So.
All right. And thank you, Rebecca. She's put in there the link for you all about the 2-page fact sheet by our ADA National Network on Service Animals. Okay, so now Deborah is clarifying her question, and I think then after this we'll have to end here. The government and businesses are not complying with Title 11 and 3.
Title 2 and Title 3.
Oh, maybe that's supposed to be 2. Mm-hmm.
Okay. Yeah. Yeah, Deborah, I think it would be best if you contacted the Regional ADA Center at 1-800-949-4232, because it sounds like to me that you've probably got a more detailed question than we can answer here today, and that there may be some, and the information specialists would be happy to talk that through with you.
All right, everyone. Thank you so much. We realize that many of you may still have questions for Pam, and apologize if you didn't get a chance to ask your question. But again, as we've been talking about, please, you can certainly contact your regional ADA center at 1-800-949-4232 to ask your question. You will also receive an email with a link to an online session evaluation after the end of this. Please complete that evaluation for today's program, as we really value your input and want to demonstrate its importance to our funder. We want to thank Pam today for sharing her time and knowledge with us. A reminder, today's session was recorded and it will be available for viewing next week at adapresentations.org in the archive section of healthcare. Our next webinar will be on June 25th. We will be joined by Nancy Mudrick of Syracuse University and Mary Lou Breslin of the Disability Rights Education and Defense Fund, and who will be presenting on the findings from a study examining the geographic distribution of accessible Medicaid participating primary care offices in Los Angeles County. We hope you can join us for that. Watch your email 2 weeks ahead of time for the announcement of the opening of that registration. Once again, thank you, Pam, and thank you all for spending some time with us, and have a good rest of your day.